This is a public health disaster waiting to happen.
On Tuesday, the Benton County Board of Commissioners ultimately voted to approve the 59-acre Coffin Butte Landfill expansion, despite hundreds of pages of testimony from residents. The commissioners themselves acknowledged reasons why the landfill poses a risk.
I also put a lot of weight into the testimony and evidence shared by adjacent property owners, especially to the west of the site, since the proximity of the new landfill area will be much closer to them than it currently is.
The Benton County Board spent the first half of the meeting outlining reasons why the expansion should be denied. But in the end, they approved it, citing Oregon land use law. The law required approval if mitigating conditions were included, but advocates point out gaps in the logic.
The issue comes down to whether the county is legally obligated to approve the permit once Republic Services added new safeguards. These conditions include funding a full-time monitor, 24/7 fire surveillance, and requiring water testing at nearby ponds.
No conditions of approval at Coffin Butte have ever been enforced in its entire history.
They haven't proven that any system that they would implement could work. And if they thought that they could control it, why wouldn't they have controlled it by now? They can't control it. Issuing this permit with conditions of approval is just keeping on with business as usual.
Advocates believe the board's reliance on the new conditions represents a shoot now, aim later strategy, choosing to wait for disaster instead of preventing it.
They said, we're going to navigate those problems and see what we can do to fix them as they show up later on, instead of taking a proactive management strategy and saying, no, unless you show us that these problems are going to be managed effectively, we're not going to approve this.
The board is not able to comment on the decision until those findings are formally adopted on November 17th. Reporting in Benton County, I'm Cameron Salinas.